The UK government and the World Health Organization says that you do not need to wear a face mask unless you have coronavirus symptoms. But in the US, Americans have been advised to wear masks in public. In Slovakia and the Czech Republic, it's actually compulsory to wear a mask if you leave home. So why are there mixed messages about wearing masks?
The scientific evidence behind whether face masks would be helpful in reducing the community transmission is a bit limited and mixed. There might be also culture and supply issues considered by those recommendation policies.
Can face masks reduce the spread of coronavirus?
So when we summarize the scientific evidence on whether face masks could reduce the transmission for influenza and SARS, there might not be a large effect, but may have some small benefits, like 10%. And face masks can reduce the virus detection in aerosols and in droplets from symptomatic patients who have been infected with seasonal coronavirus.
Who should be wearing a face mask?
It could be helpful if those high-risk group, including older adults and people with chronic conditions, wear the face mask if they cannot avoid the crowded areas. It could be also helpful if people who has been exposed to the virus wear the face mask, because the evidence of asymptomatic or pre-symptomatic transmission. These people may not know if they have been infected.
What are the pros and cons of wearing a mask?
A concern behind wearing a face mask is it could give you a false sense of security. And I think people should better stay at home and do the social distancing as much as possible. And if they can't avoid those crowded areas, it could be helpful to wear a face mask. Another concern is people don't know how to wear them properly. So if you choose to wear a face mask, please don't touch the front of it, and if you do, wash your hands immediately before you're touching anywhere else. The WHO provides a very helpful tutorial on how to wear the face mask correctly.
If you do wear a mask, what type should you wear?
The N95 respirators and surgical masks should be prioritized for the healthcare workers. If supply available, surgical masks would be a good choice.
Of course, if you do decide to wear a mask, this alone won't stop you getting or spreading coronavirus. Social distancing and regular hand washing are more effective and important in stopping the spread of the disease.